all of our travel advisor friends and partners. As always, it's a pleasure to share with you some observations, but this time with a difference. No longer are we talking about when will cruising restart. Cruising has already restarted. The Royal Caribbean Group has now carried more than 100,000 guests on over 150 cruises during the pandemic. And out of the 100,000 guests, we've only had 10 people test positive for the COVID virus. 10. And all of them have been handled smoothly and without undue disruption of other guest cruises, and without undue burden on the communities and the governments involved. This is really our objective. Few infections, and certainly lower than would be expected in the surrounding community, all handled smoothly without ruining everybody's vacation, protection of guests and the surrounding community from a big spread of the virus. Our experience with these 100,000 guests is a very powerful proof of concept. In essence, we've just had 100,000 test cruisers and demonstrated that the process works. Yippee! In this context, we need to give a shout out to the Healthy Sail Panel that we and Norwegian Cruise Line set up 9 months ago, co-chaired by Governor Mike Leavitt and Dr. Scott Gottlieb. That panel continues to advise us today, and we're so grateful for their amazing diligence over this very long period. It's truly a privilege and a pleasure to be able to watch such a high level of experience and expertise apply itself with such care and such passion to these important issues. Now, it's also important to note that our experience isn't unique. The industry as a whole has carried more than 350,000 passengers. And again, that's happened with very few cases and minimal disruption. This is precisely what we thought would be the case, and now it is the most powerful and reliable evidence in multiple real-world settings. Interestingly and importantly, all of this is before vaccines. Everybody knows that the vaccines are a game changer. They work beautifully, and I've called them the ultimate weapon. The evidence is that they work even better than most experts had hoped. But they're not the only protection we have, as our experience proves. Enhanced testing has gotten so good that it too transforms the discussion. And contact tracing capabilities on board ship have gotten so much better than anything available on land. The result of all this is a dramatic change in the landscape. We're now able to achieve our objective of being safer than your home community. That successful experience is enabling us to restart cruises in more and more places around the world. A week or so ago, we announced opening up sailings from Israel to Greece and to Cyprus. Then on Friday, we announced new sailings from St. Martin and from the Bahamas to other countries in the Caribbean. Others have announced sailings in the UK and elsewhere. The response to these announcements has been exceptional. It all reinforces the view that there's an enormous amount of pent-up demand eager to cruise again. I expect that we will soon be announcing more such itineraries. So, I'd like to take this opportunity to address some of the questions that we've been asked. The most common question I'm asked is, when will we restart cruising? The answer is, as I said before, we already have. Hundreds of thousands of happy cruisers in various parts of the world. And it's fast growing with recent announcements of more such cruises, including the Caribbean. By the way, on average, our ratings on these cruises are 7 points higher than our ratings were pre-pandemic. Clearly, our guests are loving the experience. Now, the next most common question is, will vaccines be required to cruise? And the answer to that is, we don't know. We have announced 3 cruises that will require inoculations for all adults, and there are likely to be more. But each circumstance is different, and I would note that the cruises we are currently operating are operating without requiring vaccines. But the vaccines set the stage for whatever we do. And all of our efforts are designed to make our cruises safer than walking down Main Street, USA. The situation changes every day, and we will be guided throughout by the science as it evolves and gets better and more accurate. Another key question we get is, what about the CDC's conditional sail order, and when will their next technical rules be issued? That's more complicated, but it's still very important. The CDC issued the conditional sail order last October in an effort to provide a path for cruising to reopen in the United States. The CDC has an amazing responsibility throughout the United States, and we all know they are working incredibly hard to balance the risks of the disease while limiting the pain and suffering to society. As most of you know, the order called for several phases and for the CDC to issue detailed technical rules for each phase. The first of such technical rules was scheduled to be released in December, and many of you has asked when we expect to receive them. In fact, I would answer that the pace of science has simply overcome that process. When the conditional sale order was written, there were no vaccines. The disease was on an upward trajectory and heading towards a terrible peak. Testing was less available and more costly, and therapeutics were limited. In general, the situation looked very bleak back then. What a difference 5 months makes. Today, the vaccines and other measures have changed the trajectory from a steep climb to a dramatic fall. The pandemic isn't under control, but it is getting there, and society is beginning to open up. I was thrilled when the CDC said that now that I'm vaccinated, I could play with my extraordinary grandchildren without a mask. I was over the moon when they said it was safe for school children to sit 3 feet apart instead of 6. So we're making important and impressive progress. Last October, preparing for resumption of service based on extensive protocols made good sense. But today, a vaccine approach makes much more sense than this old protocol-based approach. The vaccines are bringing down the incidence of COVID-19 in society. The testing enables us to catch cases early, and the preparation we're doing allows us to handle individual cases safely and simply. We don't know what the CDC is contemplating to address this very different set of circumstances. But just as they and other public health officials are doing elsewhere, we expect they will all adjust to the changes that have been and are taking place today. The conditional sale order was a very positive step at the time, but that time is past. We look forward to a constructive dialogue with health officials in the United States and elsewhere for the path forward under these new circumstances. It takes months to reactivate a ship, so we're not talking about restarting in the U.S. right away anyhow. But the advances in science and medical knowledge are extraordinary, and we believe that with them we can prudently and safely plan now for our summer sailings, and we'd like to do so. Of course, things can change, and if there is a surprise from a variant or from something else unforeseen, we and public health officials clearly understand that we'll have to adjust to take any unexpected circumstances into account. But since it takes so long to activate a ship, we need to start planning now. And we need to base our planning decisions on where the science says we're likely to be, not where we were in the past or we are at any given moment. One thing that can mess this up is if we, as a society, get complacent. Masks work. Vaccines work. If we let our guard down and stop taking simple precautions, we could cause another spike. That would really make me cry. So I therefore encourage all of you to get your vaccine, follow the CDC's advice, and we can be sailing in time to meet President Biden's goal of reopening society in time for the 4th of July. That would make it an especially memorable Independence Day. And don't get lazy. Wash your hands and wear that mask.